So let's talk about the cuspal coverage amalgam. Now, you're not going to see a lot of this stuff on YouTube because it's kind of going by the wayside. However, in our patient demographics, it works absolutely beautifully, especially after root canal tooth. We've got this molar that's been root canaled, and now we place this cuspal coverage amalgam, which really serves one purpose, is protect it from fracture down the road, and then it serves to get this patient fit. So rather than having your patient, for example, having 5 appointments for a root canal and crown, because there's always going to be some sort of extra. It'd be like pulpectomy, then cleaning and shaping and obturation. That's the second appointment. Then your third appointment is core. Your fourth appointment is like impression. Your fifth appointment is like delivery. This can be done in, say, 3 appointments. So clean and shape, pulpectomy, then clean and shape obturation, and then bring them back for the cuspal coverage amalgam, and then they're good, they're fit. And what I really believe that this does is it serves another purpose, is that we know that these teeth need to be crowned. Depending on where you're posted, your patient population really doesn't care about the aesthetics, but they do care if they have to come back if this tooth is broken. But what you can do is use your time for crowns to really, either do those aesthetic cases in the anterior where a cuspal coverage amalgam on an anterior tooth is almost impossible to do aesthetically. So you need to go with a porcelain crown, or, for cracked teeth. Save those crown appointments, because those are teeth that, you might be able to get 10 years out of a crown before it needs a root canal. So I really want to stress the importance of this restoration in our patient population to get the patient fit, and then also to use your crown time, your other appointments, for actual cases that can't be best served by this restoration. So let's go ahead and get started. Let me close this out. And here we go. So what I'm going to do is, you've probably seen these before. I'm just going to play this along. These, if you haven't seen these little defender wedges, they're great. They're good for a couple things, protecting the adjacent teeth, but also creating your contact, because you're going to get a little bit of movement before you wedge your teeth. You might be able to get your band down a little bit easier. So really what we're going to be trying to do, we're going to pretend, even though this is composite, we're going to pretend this is all tooth structure. So we just got our access. And really the intent is to do a 2 millimeter reduction. So here we have a 557 burr. Now the problem with this burr, it's great because it cuts really efficiently, but the problem is that it's got a square end, and I think after 20 years of doing practice, I think it's really not a good idea to use a square-ended right-angled burr. Use something more rounded. So you're going to see me pull out a 330 for doing a box. Now it's really critical. I've done a lot of these, and I can tell you that if you just reduce the occlusion by 2 millimeters, and then try to pack your amalgam, it's going to pretty much fall off. There's not enough shear strength of this newly formed amalgam with the pulp chamber and a flat table. Really what you need to do is create your, cut down your boxes, create boxes. You can use a 330, which is only a 0.8 millimeter diameter. Keep it really narrow, and that will give you enough resistance form to carve your amalgam. So what we're going to do first, just like a crown prep, is we're going to do our 2 millimeter reduction. I know that the diameter of this burr is 1 millimeter, so I'm going to go 2 times the depth. And we'll just speed this up because it's pretty straightforward. You can do this dry. The tooth is dead already, so it might smell a bit in the patient's mouth, but it will speed up especially on an upper, you won't have to have water on your mirror. So we're going to do our depth cuts. And then what's really neat is you can use your Explorer to double check to see if you've got your 2 millimeter reduction, and it's really quick to see. This again is just composite. We're going to pretend it's tooth structure. So here we are, and then what you can do is just do your reduction, connect the dots, and then that's about it. So it's pretty straightforward. I've tried practicing in real life using a burr that has a flat it looks like a pancake on the end. I try not to use that in real life because it creates too much of a flat surface and your amalgam just breaks off when you're carving it. So I recommend trying to keep these undulations to kind of create a resistance form just to help you prevent fracturing this off. This is the biggest issue with these restorations, is the complexity in my mind just comes from breaking it when you're carving it. So what we're going to do here is we're just using a 330 burr. We're just creating our gingival finish, starting to round things off. We're going to be using the pulp chamber as a lot of retention form, so we don't need to make any like pins or put little dots or anything like that as retention. What I found is that if you try to use these in real life, these teeth are mounted in triad, but if you place these in real life, it seems like you can't get two of these in at the same time. So it kind of replicates what we're doing here in real life, just using the fender wedge on one side. So like I said, this burr is 0.8 millimeter diameter. So we're going to cut a really narrow little box just to be able to get some resistance form and also to get our band down, because and it seems like it's like, oh, I'm doing my initial impression of doing this was, oh, I'm reducing tooth structure, but honestly it's 0.8, and by the time you cut any type of crown at the end of it, I mean, zirconia is 0.5, but let's be honest, getting a 0.5 is pretty impressive if you can do it. So doing a 0.8 is not that much tooth reduction, and if you're going to do your crown afterwards, you're just going to burn out that amalgam anyways. You could actually argue that this is more of a more conservative preparation. And I'm not going to go down the road of that detail, but actually what we're doing is we're not burning away this tooth structure, which is closer to our orifice. So we're actually preserving tooth structure. We're doing a 2 millimeter reduction, which is 0.5 millimeter more than on our working cusp than any type of porcelain, or even a millimeter more than like zirconia. However, we are preserving almost where our pericervical dentin is, because we're not whittling it away with a burr. So keep that in mind. So what I'm doing here is I'm just literally rounding off everything. Let's just speed this up. So then what I'm going to do is I'm going to take a diamond. You don't have to, I just did for this, and quite frankly I think there was one lying in our skills bay in PET. So we're just going to round everything off, make sure everything's smooth. And the reason why I'm rounding it off, a good buddy of mine, Amir, taught me, it was a really good idea, was, let me just back up here, was to actually round all the corners, because when you go to carve any of these, if they're a sharp angle, it's another probability of having a piece of your amalgam fracture. And I can tell you I've had a lot of these fractures, so I'm trying to minimize that fracturing problem. So really what we've done at the end of our preparation, we've made a mesial and distal box. I started removing some of the composite here, then I just decided we'll make it tooth structure because it's going to go too deep for this demonstration. And then we just made sort of an undulating finish line. It's just literally flat. There's no chamfer, there's no shoulder. It's just literally flat. And then we rounded all the edges off internally. Excuse me. So I recommend, in terms of restoring this now, what type of matrix system? Really, I've taught our new captains here in PET just to use auto matrix. It is so much easier than trying to fiddle with a Tafelmeier. There's a whole bunch of different bands. I've got another video on that as well. Just grab a Tafelmeier, practice with it before you go to use it, and then give it a shot. Practice on your extracted tooth because it's really helpful. So I'll open up the auto matrix beforehand with my fingers, and I'll pull it out a little bit more so it'll fit over the tooth, and then we're going to slide it down. And because we've opened up the contacts everywhere, it's just going to slide pretty much down. And if it's hard to hold on to, like it's pretty easy on a tabletop, what I'll get my dental assistant to do is I'll actually hold this in place, and I'll get my dental assistant to tighten this to, a couple clicks. And then what you need to do is just revert lefty loosey on the handle, and that's it. I'm going to place a couple wedges. We're going to burnish our margins in. Sorry, I don't know why I keep saying margins. We're going to varnish our contacts. That's really sweet. These are sweet. I just saw these in PET. They're really nice. That's a little bit too small. Really nice wedges on the stick. Push and twist. Pretty handy, actually. So I'll twist it off. Now, what you're going to see is that actually one of our captains was watching. So I had some plumber's tape or Teflon. This is actually really thick. I don't usually, I don't even know where to buy this, but it's thick. It's at the hardware store. It's sterilized, so it's a little bit thicker Teflon. You can get thinner stuff, but it was really helpful to. I used it on here, but I couldn't. There's actually on this distal margin. It's a little bit open at the gingival box. So I just take any type of instrument. You just sort of pack it in underneath between the wedge and the between the wedge and the tophomer. You'll see me take that out actually, because once I burnished this, I used once I burnished this burnished this contact, and you can see because it was pretty narrow. Let me just go slow speed here. Because it was pretty narrow, this little box, what I did was I just took a spoon and I just used that to burnish that interproximal contact. Well, once I burnished it a bit, as I'm extracting my tooth out of the triad, once I burnished it, I opened up a bit of the gingival margin of my tophomer. You can see right there. It was really a little bit of hair. So actually one of our captains was asking about the Teflon. I said, well, what you can do is take it. So I took it out and I'll pack it back into here. Take it out, and then what I'm going to do is pack it again. I'm essentially packing it between the wedge and the tophomer, and that closes that up. In another example that I was filming, but then I broke the amalgam, so I didn't really want to keep that. What I did do is I actually used see where there's actually excess. You're going to pack a whole bunch of excess amalgam in here. What I did do is I took Teflon and packed it in here up to the level of the tooth. And that actually sped up. That's less amalgam that I'm packing in there, and it actually sped up my procedure. So that might be another option that you can do, is place some Teflon in here. It's pretty helpful actually. But I think I ran out of Teflon, and then I was just probably too lazy to go get some others. Let's be honest. So I'm going to pack it in there, and it actually works magic. If you haven't used this stuff, give it a shot. I've actually used it quite frequently for crown impressions for packing instead of packing cord. I actually use this instead. I mean, it's got its limitations. You can only pack so much in there. So now it's time to, we burnished our interproximal contacts. We've got a good gingival seal. We're going to place our amalgam. Now resist the temptation to take this little ball and magically put it into there. I have done that for years, and I'll tell you, I got 20% success and 80% failure of fracturing a piece of this amalgam off. I think doing that, it is easier. It speeds up your carving, the time from condensing to carving. But the problem is that it doesn't condense it properly enough. I don't even know if that's a factor, but I can tell you a factor is that you start carving too fast, and it hasn't had time through its working time to really start setting up. So just go through the labor of love of using the amalgam carrier. And if you haven't used these type, I would highly recommend it, especially if you're working with a dental assistant forehanding this, which is the most efficient way to do it. This plastic type of burnisher allows the dental assistant to come over from their angle really easily and get it into that tooth. And one of the things that an old timer taught me, which I guess I'm an old timer now, was when you're packing your amalgam into your boxes, pack it down and then you'll see me slide the margin or the condenser back and forth along, buccolingual, just to pack some of the, kind of pack the amalgam into the corners right there. You can see I'll start doing it some more. So I'm packing it, sliding it back and forth just to make sure I get in all those nooks and crannies. Because there's been many times where I just pack it down and I forget to do that. And then I've got this open margin, and then you sit there and think, how am I going to try to pack amalgam back in there? And then you're with the burnisher or some sort of flat-ended instrument trying to flatten it against, trying to burnish it towards the tooth. Just do that and it'll help you out. So this is pretty basic amalgam filling, amalgam restoration. So I'm going to fast forward. You're going to see me just continually. You're going to need about 4 or 5 of these. These are Valiant PhD. I think they're single spills, maybe double. We used about 4 or 5 of them. So we're just packing around. You can see if I had that Teflon packed in here, I wouldn't have to fill that right down to where it contacts tooth structure. So of course what we're doing is I'm just kind of watching where the margins of my adjacent teeth are, and then we're going to smooth that around, kind of get a basic idea. and then off to the races. So here we go. So I'm going to start carving. The first thing, there's many ways to do this. What I do now is I'm just going to take my Explorer, use like 3 instruments. I'm going to use my Explorer just to kind of explore and try to figure out where my 2 structure is. Like just a basic idea. So I'll run it around, kind of, I don't know if it's useful, just run it around. It's just what I've done. So I'm trying to slowly move apically and find where that 2 structure is. When I can feel it with my instrument, with my Explorer, what I'm going to do is slowly start kind of just pushing. I don't know if it's burnishing, but it's more like just kind of pushing away amalgam to get it out of the road. So you can see I think I've found the 2 structure. I'll do that the same on the buckle. And I'm going to try to accomplish, I think the most important part here, and I've seen success with the captains when they do this now, is we're going, oh, that's right. You know what I did is I fractured off that piece. Look at that. So even in the demo, I fractured that off. Take a look here. So it's fresh enough. Yeah, watch this. So it's like this, I remember this chunk comes flying off. I'm like, ah. Anyways, it's real life. You're going to see me actually carve too low, and I'll show you what to do after that too. So I think that comes flying off here, and I was like, oh, not another one. Yeah, there it goes. And actually, you can't even see it in the film. I don't know why I redid it. Anyways, so I'm just going to, we're still at the setting stage, so we're still good. We'll pack some more in there. It's really important now, I think, to talk about kind of what are the key things we're trying to achieve when we're just starting to carve. And to me, it's not the occlusion. You can really adjust the occlusion with a burr at the end of this, but you can't adjust overhangs really easily with a burr. You can, but it's really frustrating. So really I've seen success with our captains to do this, is to tackle as much of the interproximal and gingival areas right now while it's still setting, and then don't even touch your occlusion until the end. At the end, once this sets up, you can take a slow round burr and just do your occlusion. And again, we're not trying to win the most beautiful 5-surface amalgam award. We're trying to win the, as Major Dosty, my periodontist friend here in Pet would say, he probably doesn't say this, but we want the periodontal award. We want this thing to look, and here, this is where the ugly bird gets the worm. We really want this thing to look awful, but we want it to serve a purpose. We want it to protect our tooth, but we also want it to connect with the adjacent gingiva as best as possible. So we do that by achieving gingival contours, interproximal contours, and contacts before we even attack the occlusion. So at this stage, what I need to do is I'm just going to open up. So we take our pliers, the cutters, we snip this little clip. And then what that does is, this is a full circle clip. It kind of loosens it up. Now I'm not going to take this off. This band does not come off for a long time. What I'm going to do is I'm going to open up so I have a little window. So sometimes you need to push that apically, this little clip, or you just open that up and see there's a little hole here, so you can kind of use your Explorer and pull it open or whatnot. And what I'm trying to do is I'm just trying to see the buccal window. So what's happened is I've had to pack in new fresh amalgam, so I'm going to let that set for a little bit. And I'm going to do the same thing that I did on the buccal. I'm just going to try to find where my 2 structure is and slowly touch it. Here I'm just pushing the band out of the way. I'm really just trying to create my buccal contours right now as best I can. So that little clip will get out of the way soon. I'm going to unravel that slowly but surely. Nice and delicate. Don't breathe on this. It might fall apart. Just be careful. Let's bring this up here. So as you can see, I'm just creating my contours, and you can see here, so I've got 2 structure. Now I'm going to try to slowly kind of either bend this band out of the way or just kind of push it. I might have pull it through a bit of the contact so I can get a little more access, a little visibility, and create those, like I said, we're going to get those gingival contours. It's really hard to do that with a burr. Much easier to do with a hand instrument. So one of the captains actually mentioned, and I'm glad we did this procedure with her tabletop. One of her instructors in school said never touch, and she went to U of T. I'm not shaming U of T. That's not what this is about. It's really, but I was shocked, and I think I understand the concept. But they said never touch a amalgam with a burr. And I think what the idea was is that as a student, because your dexterity and your your hand-eye coordination isn't as astute as somebody with 25 years doing this. Don't touch a burr to the amalgam because you're going to create a big hole in it while you're forming it. But that's totally what we're going to be doing here. We're going to be using our amalgam at the end. So while I'm just waiting for more of this to set up, because I don't want that to fracture off, and I don't want to, what I'm going to do is I'm going to do some large occlusal adjustment real quick using this Clapton. So one of the tips that was taught to me by an old timer, I guess I'm the old timer telling you now, is to always pull away from the marginal ridges. Don't push to it. Pull away so you don't end up fracturing it. So so even here I'm going to push away from it or use the other end of the instrument. You can pull. This instrument is used for both sides, mesial and distal, or if you can just rotate the patient around in the chair, just like I did here, you can just use the one end. So we're just getting some big kind of cuspal, big occlusion reduction, kind of getting the occlusal contours. But that's about the only time you're going to see me kind of finagle with the, to play around with the occlusion. All right, so we're just going to keep working on that gingival contour. I should be pulling out my interproximal carver soon. There we go. Now we're opening it up a little bit more. There we go. So this is like by far the best instrument in my opinion for this technique. This has, you can see it's got a nice curve and you can create many different contours with this bad boy. So you can use it like a scaler and kind of carve upwards. We're carving in many different, let me pull this back down here. There we go. So we can carve sort of that, the facial to occlusal contour, and the same on the lingual. I mean, you can just see what I'm doing here is I'm carving all my gingival aspects, all my contours with this one instrument. And I still have the band on. I haven't taken the band off. We're waiting till the last second to take that band off, because that's the one thing that's going to save us from this thing fracturing right now. I don't know, maybe it won't, but anyways, that's my thought. So again, I'm pushing the band slowly out of the way so I can get better visibility on my tooth structure. And you can see here now, I'm just finessing those contours. You can see all the different ways I can use this instrument. So we're just doing this, we'll speed up. And at this time, what's really useful is to have your dental assistant lightly blowing, not lightly, but just puffing air once in a while with a suction, rather than just, some may just want to watch you and your remarkable skills. But I would recommend, because it'll speed up the process. This instrument's amazing for creating your occlusal embrasure as well. We'll get down to that once we get closer to our, because we're way too high on the distal, I just noticed. So we'll be using that down the road. Actually, I was just thinking as I'm recording this voiceover, some of our Petawawa captains will actually be there. And I think one of them was actually there watching me film this too. And I didn't break it. Mind you, the other one was standing there. There was another captain standing there. I did break it. I had to restart over again. So again, we're just, excuse me. Okay, we're gonna take our wedges out. Oh, we're getting ready for the big show here. Might be taking the band off. Yep. So my experience has been that cotton pliers are terrible for pulling matrix bands or Toffelmeyers off. So in the Toffelmeyer, or in the Auto Matrix, you've got the little hole so you can use any type of instrument here. I think I really burnished that band, so I don't know if we're going to get that off easily. Or just use a pair of hemostats. It's really effective intraorally. I come back with those things, just wasting my time. Nothing, but make sure you're going to pull out at an angle. That's critical. I'm just going to use my finger. It's easy because it's not wet. but in the mouth it might be a little bit wet. And just as I was thinking about this, like you can still place this on a 1/7. We just did one last week, a 2/7, a 3/7 with the clamp. Place it apically, place your automatrix on there, and go. Instead of taking the rubber dam off, you will save so much more time. Okay, so what we're going to do now is we're going to pull that Teflon out of there, and then we're going to work on our interproximal contours. Make sure we don't have any overhangs. Make sure everything's closed. All our margins are sealed. This instrument is incredible, and it's usually really sharp because no one uses it. If it's in your kits, I'd highly recommend getting one. Just trying it out anyways. If you don't like it, you don't like it. Give it to somebody else. So again, the only time we've actually addressed the occlusion was just with that collapsing, just to kind of reduce it. But other than that, we haven't done anything. And this is how we really prevent overhangs and make sure we've got a good interproximal contact. So you can see all that material we're removing. Making sure our tip is on two structure and then pulling up. So again, it just looks like a pebble from it looks like a rock out of a river or something, and that's really kind of what we're looking for. We're not looking for fancy. We're looking for a functional restoration that maintains our gingival health, protects our tooth, and gets our patient fit. We're not going to win any Instagram pictures on these. That's not the intent. So I'm going to take my Clapton. It's a really useful instrument here. I'm going to do a quick reduction, and what I'm doing is I'm running half of that instrument on the adjacent marginal ridge, and then I'm bringing down the marginal ridge down to the height of that one. Another way you can see if you've reduced enough of your amalgam is just measure from where your height is. So from the top of the occlusal plane, a level, to where your tooth structure is. If it's roughly 2 millimeters, you know you're in the ballpark. If you're less, then well, you're less. But if you're too high, you know that before you even take the rubber dam off and get the patient to bite down and then break your whole thing off, you might be, or you're going to be there forever, just adjusting with articulating paper. You can adjust it real quick before you try to check your occlusion. So this is another quick way just to get in the ballpark. So you can see the amalgam is now setting up pretty well. It's shiny when we use hand instruments on it. So I think now what we're going to do is take a slow round burr, run it around 10,000, or maybe not. We're going to take again, this instrument's amazing because it's super sharp. I can create that occlusal embrasure, so we get a really nice contact. Okay, so now I think we're going to come out with the slow speed. We're going to take like a number 6, number 4, I think it's a 6 round burr. And we're going to do here again, because we're using a slow speed, I'm going to run that right along. I mean, if this was two structure, fine. Just watch if it's a composite or another type of restoration. But if it's two structure, you can just run that right along the marginal ridge with very little fear of damaging it, just to get that height of the occlusion. And then now what we're going to do is we're going to build in our occlusal scheme. Essentially what you can do, I remember another mentor of mine just make a sluice way, I think he called it. Essentially, a nice valley from front to back in the tooth, and you're done. So you can do that. Of course, because this is a demonstration video, I'm going to try to make it my best ever. So what I'm doing here is I'm running the the 2 millimeters just to see if I've over reduced my amalgam or if I'm in the ballpark. And I've over reduced a little bit, but I know that I'm not too high, so I know I'm in the ballpark in terms of before we take this off, before we would take the rubber dam off and check our occlusion. So we don't, so there's two scenarios. One, you're sitting there adjusting the occlusion for days, or the second scenario, you break a piece off because you're too high. Right here is a very interesting point right here is I actually reduced too much of the amalgam, this little piece of dentin. Now, my experience has been now what's happened is we thin this amalgam and it increases the probability of breaking that. So what I'm going to do is I'm actually going to take a high speed and prep that out, and then we can take a look and then see this is going to happen. If you break a piece off, I mean, you can just leave it, kind of see how it goes, or you can prep into the amalgam while you still got it. You can maybe place half a matrix. I don't know what you need to do, but something. Maybe replace a tophomer, pack it in there, and then keep going. And it depends on how much time you've got. It depends on your skill. There's lots of different things. But what I'm going to do here is I'm going to take that 330 burr, prep that out, and I'm not too worried because it's a non-vital tooth already. So it doesn't really matter. Tooth dead. I just want to make sure that we're not going to get any fracturing down the road. So it's quicker to fix it now than it is when this thing goes like this, like breaks, front to back. Then it's another whole restoration. So solve it the easy way. So we're just finishing our contours here. I'm not really happy with that. Sort of that, you can see that mesial embrasure in that distal tooth kind of comes in like this. So now I'm just doing finicky stuff. Let's speed up here and see what happens. So we're just using this is just the final details of our work. So what we do now is just take our burnisher. We're going to burnish any margins we can see. We're going to burnish between tooth structure and restoration, any margins we can see. Again, this is composite. We're pretending it's tooth structure, so just disregard that. I'm going to come back with my inner process. So we'll check our contacts. They're good. So now what I'm going to do is I'm just going to go back and prep out that little spot. You can see actually where I thinned out a lot of it, where the amalgam is thin. So I kept going just to add some more. So prep it out. There's an undercut there. And then we'll place our amalgam again and keep going. This was an easy fix compared to breaking off half of that, half of the restoration. So again, we're just coming along with that interproximal carver. Oh, there's the discoid finally. So get our discoid out. And again, because it's a demonstration video, we're going to make it look pretty. So we'll just really speed this up. There's not much more to glean other than me just making it look like I have a couple of skills that I've created over the years. That's about it. But honestly, beyond this amalgam was done after I repaired that little patch there. This is just now kind of potentially wasting the patient's time. The final details, just because we wanted to. Let's see what we're doing here. Just going to clean up all of that excess. Okay. So that's a restoration, and like one of my captains said, you can polish it once it's set for 24 hours. The polishing, I used to do this when I was in Belgium. I used to bring patients back and polish their restorations, and they actually kind of thought it was a waste of time. They didn't even know what it was for. And I used to say, well, it's just to make it look good and smooth. They couldn't tell the difference. So it really, in honesty, it's just for yourself. So if you tell your patients, this is just to make me happy, there has been no literature to support this actually makes the restoration any better. Just makes it look nice. So when the next captain comes along, they're like, oh, look at that restoration. It makes you kind of feel good. Regardless, You can use a white stone, a green stone, white stone, and then a brownie. That's all I'm doing here. We're spinning it at around 10,000 RPM in the slow speed, just to make it look pretty. And then we'll get out our, we'll really speed this up. Then we'll get our greenie out, really polish it out. So what happened was one of our captains did this. I saw him. He was like, I'm going to polish it up. I'm like, you know what? I'm going to do that too. I haven't polished amalgam for a long time. So there's our restoration. Okay. So that's it. So hopefully that helps. We're trying to get to this type of picture right here. And I hope you have some good discussion.